Hello everyone, my name is Farhan Khalid and I'm a medical student at McMaster University. Today, I'm excited to present our research project entitled Intravitreal 5-fluorouracil and low molecular weight heparin injection for proliferative vitreoretinopathy in Rhegmatogenous retinal detachment surgery, a meta-analysis. I thank my co-authors for their continued contribution to this project. The financial disclosure of the co-authors are on the screen as follows. To provide some background, proliferative vitreoretinopathy, or PVR for short, is a sight-threatening complication following rhegmatogenous retinal detachment repair. Because of the devastating consequences of proliferative vitreoretinopathy, including but not limited to recurrent retinal detachment and vision loss, it is a major ocular concern. Previous studies have shown that an injection of combined low molecular weight heparin and 5-fluorouracil may be able to reduce the risk of proliferative vitreoretinopathy, which was the basis of our study. The purpose of this study is to assess the safety and efficacy of 5-fluorouracil with low molecular weight heparin for the prevention of proliferative vitreoretinopathy following pars plana vitrectomy for rhegmatogenous retinal detachment repair. Our primary outcome measures include the incidence of proliferative vitreoretinopathy development, and secondary outcomes include primary and final reattachment rate, intraocular pressure, and adverse events such as glaucoma, keratopathy, anterior chamber flare, macular pucker, and cataract formation. Our search strategy included a comprehensive search of 3 databases, namely Ovid Medline, Embase, and Cochrane Central, from inception until May 2021. For inclusion, we looked at all manuscripts and abstracts if they studied the prevention of proliferative vitreoretinopathy following rhegmatogenous retinal detachment repair. All patients must be greater than 18 years of age, and the treatment of interest was 5-fluorouracil with low molecular weight heparin. The studies must report data on safety and efficacy outcomes. We included all languages. The screening process involved 2 steps of title and abstract screening and full text screening. All studies were screened in duplicate and independently by each reviewer. For our results, 5 studies with a pooled total of 539 eyes in the 5-fluorouracil with low molecular weight heparin group and 516 eyes in the treatment-naive group were included. Patients were followed for a median of 6 months. Figure 1 shows that the incidence of proliferative vitreoretinopathy following pars plana vitrectomy was not significantly different between the 5-fluorouracil with low molecular weight heparin group and the no adjuvant group. Continuing on, the primary reattachment rate was not statistically different in the 5-fluorouracil with low molecular weight heparin group versus the no adjuvant group. The final reattachment rate was also not significantly different between the 2 groups. Finally, the retinal redetachment rate was not significantly different at 15% for the 5-fluorouracil with low molecular weight heparin group and 23.4% for the no adjuvant group. Our key findings suggest that the risk of PVR formation following pars plana vitrectomy was not significantly different between the 5-fluorouracil with low molecular weight heparin group and the no adjuvant group. Recurrent retinal detachment rates were also not significantly different for the 5-FU with low molecular weight heparin group and the no adjuvant group, and that there were no significant differences in adverse events such as elevated intraocular pressure, glaucoma, keratopathy, anterior chamber flare, macular pucker, and cataract formation. In conclusion, based on the available evidence, there are no significant differences in safety and efficacy outcomes between 5-fluorouracil and low molecular weight heparin versus no adjuvant treatment for the prevention of proliferative vitreoretinopathy. Thank you for your time. If you have any questions, please feel free to reach out at farhan.khalid@medportal.ca. Thank you.